That healthy glass of grapefruit juice you enjoy with breakfast is capable of making your daily medication 3 times more powerful. This isn't a myth, it's a scientific fact, and it reveals a hidden danger that exists in so many of our kitchens. The risk of common, healthy foods interacting with the medications we rely on every single day. It's a frightening thought, but understanding it is the first step toward taking back control. Hello, my dear friends. I'm Dr. Emily Hart, and I'm so glad you're here with me today. My goal is to take complex medical science and make it simple, clear, and useful for you. We're not here to create fear, we're here to build confidence. Before we dive in, I would absolutely love to know where you're watching from today. Please tell me in the comments below. It brings me so much joy to see our wonderful community of strong, vibrant women connecting from all corners of the world. And if you believe in the power of knowing more about your own health, I invite you to subscribe and join our family. So, let's start with the most important question. How can a simple food possibly interfere with a powerful, scientifically designed medication? It seems almost unbelievable. The best way to understand it is to think of your body, particularly your liver, as a very busy highway system. When you take a medication, it's like a fleet of cars entering that highway. Your body has a dedicated team of road crews, special enzymes, that are responsible for breaking down those cars, or medicine molecules, at a specific, predictable rate. This ensures you get just the right amount of medication in your system for just the right amount of time. But now imagine you eat a certain food. That food contains compounds that act like a roadblock. Suddenly, those road crews, our enzymes, can't get to the cars. The highway gets completely gridlocked. The medication isn't broken down as it should be, and the cars just pile up, creating a traffic jam. This means the concentration of the drug in your bloodstream can skyrocket to dangerous levels, all because of something you ate. It's not magic, it's just biology. And now that we understand the how, let's look at the most famous culprit behind this exact kind of traffic jam. A fruit that many of us believe is the very picture of health. I'm talking, of course, about grapefruit. For decades, doctors have warned patients about it, but many of us don't know the real reason why it's so risky. Grapefruit and its juice contain natural compounds called furanocoumarins. These compounds are incredibly effective at shutting down one of our most important road crew enzymes in the body, an enzyme called CYP3A4. This enzyme is responsible for breaking down more than half of all prescription medications. When you drink grapefruit juice, you effectively put that enzyme out of commission. So if you're taking a common statin for cholesterol or certain blood pressure medications, and you have a glass of grapefruit juice, your body can no longer process the drug properly. The medication builds up in your system, and a safe prescribed dose can suddenly feel like a potential overdose, increasing the risk of side effects like severe muscle pain or kidney damage. And here's a truly surprising fact that I want you to share in the comments if it's new to you. This effect isn't temporary. A single glass of grapefruit juice can impact how your body processes medication for up to 3 days. It's also not just grapefruit. Seville oranges, which are often used to make marmalade, as well as pomelos and tangelos, can have a very similar effect. It's a powerful reminder that even the most natural foods have potent chemistry inside them. But what about the opposite? What if a healthy food could actually stop your medication from working at all? This happens far more often than we think, especially with one of the most important medications for protecting so many of us from strokes and blood clots. This is what I call the vitamin K paradox, and it involves the very foods we're told to eat for a healthy heart. Millions of people rely on blood-thinning medication, with the most common one being warfarin, also known as Coumadin. This medication works by carefully blocking the action of vitamin K in your body. Vitamin K is essential for blood clotting. It's what helps you stop bleeding when you get a cut. Warfarin's job is to reduce vitamin K's effect just enough to prevent dangerous internal clots from forming. Now, where do we find vitamin K? In some of the most healthy foods on the planet. Leafy green vegetables like spinach, kale, Swiss chard, and broccoli. So, can you see the problem? You're taking a medication designed to block vitamin K, and then you eat a big, beautiful salad packed with vitamin K. The food is essentially fighting the medicine. If you suddenly decide to start eating a lot more leafy greens, you could overwhelm the medication, making it less effective and putting yourself at risk. It can feel like you're caught in an impossible situation. You're trying so hard to do everything right for your health, and yet it seems like you can't win. The key here isn't to stop eating these wonderful vegetables, but to be consistent, which is something we will talk about in our action plan. It's not just about what you're eating for dinner, either. Sometimes the interaction can come from your morning glass of milk or even a sweet treat you thought was harmless. Let's uncover a few more of these surprising suspects so you have the full picture. Many of us know that we need calcium for strong bones, so we drink milk or eat yogurt. But if you're taking certain antibiotics, like those in the tetracycline family for a skin or respiratory infection, that calcium can be a real problem. Calcium can bind to the antibiotic in your stomach, creating a compound that your body can't absorb. It's like putting the medicine inside a locked box that your body can't open. The drug simply passes through your system without ever doing its job. This is why you're often told to take these antibiotics an hour before or 2 hours after a meal. Here's another one that might surprise you: black licorice. I'm not talking about the red, fruity kind, but the real licorice, made from the licorice root. It contains a substance called glycyrrhizin, which can cause your body's potassium levels to drop. Low potassium can be dangerous, especially for your heart, and it can seriously interfere with the effectiveness of heart medications like digoxin and even some blood pressure pills. A little bit might be fine, but consistently eating it can cause real trouble. This shows that interactions aren't just in the produce aisle, they can be hiding in the candy aisle too. I know that hearing all of this at once can feel overwhelming, maybe even a little bit scary. And if you've been doing any of these things, please do not blame yourself. You were trying to be healthy and you were acting on the best information you had. The goal now is simply to add this new knowledge to your toolkit. So, I want you to take a deep breath. Please know that this knowledge isn't meant to create worry. It is meant to create power. The power to be the most informed, proactive advocate for your own health. So let's put all this concern aside and walk through a simple, clear, 3-step action plan to turn you from worried to wise and keep you safe. First, your mission is to become the ultimate expert on you. Grab a notebook and make a complete and total list of everything you take. I mean, everything. Write down every prescription medication, every over-the-counter pill like aspirin or allergy medicine, every vitamin, every mineral supplement, and every herbal remedy. Don't leave anything out because it all matters. Second, take that list and make an appointment. You can speak to your doctor, but I'm going to let you in on a secret weapon for your health: your pharmacist. They are one of the most accessible experts, and their specialty is understanding exactly how these substances interact. Schedule a dedicated medication review. Don't try to do this in a hurry while picking up a prescription. Set aside the time. Hand them your list and ask this specific question: are there any foods or drinks I need to be careful with while taking these? This is your moment to get clear, personalized answers. And third, for things like leafy greens and warfarin, the goal is not avoidance, it is consistency. Work with your doctor or pharmacist to understand what a normal, consistent amount of vitamin K-rich foods looks like for you. If you typically have a salad 3 times a week, stick with that. The problem isn't the salad, it's the sudden dramatic change in your diet that throws your medication levels off balance. Consistency is your superpower. Following these 3 steps transforms you from a passive patient into the confident CEO of your own health. And that feeling of being in control is what this is all about. So, today we've unraveled the mystery of how foods and medicines can interact. We've learned that a healthy diet is still the cornerstone of a healthy life, but that we must be smart and informed about how our food choices can affect the medications we depend on. Being your own best advocate isn't about being suspicious of every meal. It's about having respectful, informed conversations with the people who guide your healthcare. You have the power to protect yourself, to ask the right questions, and to live a full, vibrant life with confidence. Your very first stop today, right after this video ends, is a simple one. Just grab a piece of paper and a pen and start that list. That's it. It's the first step on a path to greater peace of mind. And if this video has helped you feel a little more in control, please consider sharing it with a friend, a sister, or a neighbor. We are all in this together. And by sharing good information, we help lift everyone up. Thank you so much for spending this time with me. It is truly an honor. Take wonderful care of yourselves, and I cannot wait to see you again in our next video.